So we want to talk about the importance of spinal extensions, back bends, opening the heart, versus the rounding, the closing of the heart, and rounding of the spine. Spinal flexion, hip flexion. This is a model of your spine. This is the back side of the back. This is the spinal cord running through the transverse process and spinous process. This is your disc, and we often hear people say, I have a bulging disc at L5 and 4, or I have a herniated disc, or I have a ruptured disc. What exactly does that mean? There are two weak spots or areas that are not covered by a ligament. The anterior ligament runs in front of the disc, the posterior ligament runs to the back. And for some reason there seems to be a space between those two. As load, weight bearing, is put on the front of the disc, over time, eventually that weak spot, as the load is put on the front of the spine, eventually over time, that disc can weaken in that location, creating a bulge, a herniation, and eventually a rupture. Now keep in mind, accidents can also cause this, but the people that I'm working with come in with a disc bulge from poor posture. They feel like rounding of the back gives them relief, which it does initially and temporarily, but over the long term, it actually weakens this spot where the disc bulges. We want to incorporate a practice for back health that is strong in a lot of extensions, the teardrop, any kind of back bending practice, anything to help lengthen the front side of the body. This also helps to push that disc matter back in to into between the vertebrae, and over time then scar tissue will form so that the disc won't bulge again. But if you're continuing to sit with poor posture, riding your bike, doing a lot of yoga where you're rounding the spine, you're actually weakening this area of the disc, and where it presses onto the nerve and creates a lot of pain and discomfort. So when your teachers tell you to hinge at the hips, they mean hinge at the hips, not rounding of the spine. I tend to avoid any kind of forward folding in my practice, very limited, because even now I'm in a forward fold. I'm shortening my hip flexors to sit here visiting with you. When I drive my car, my hip flexors are shortened. A lot of people tend to then get sloppy in their low back, which creates that pressure to the front of the disc and weakens more and more the low back.